So I'm here with Darin Ingels, and we are repeating an interview we did quite a long time ago now, so that we can share the benefits of AMD ion foot cleansers. Now, Darin is a naturopathic doctor over in California in the USA, but I've asked him to explain, first of all, what a naturopathic physician actually is in America, because it's different to what a naturopath is in Australia and New Zealand.
Sure. Well, naturopathic doctors, and depending on the state you're in, some are called naturopathic physicians or naturopathic doctors, but it really is physician level training. Now, we do 2 years of basic biomedical science. You learn anatomy, physiology, biochemistry. And then the second 2 years is really focused on clinical training where you apply all your naturopathic therapeutics. But again, we learn pharmacology. Here in the state of California, we can prescribe medication if we need to. But most naturopaths I know, I mean, still use their foundational naturopathic therapies first. And there's a hierarchy of therapeutics. You try and use the most effective, least invasive, least toxic therapy first, and then you kind of move up the rung of the ladder with each patient as you feel like you need to. So our training here, as I know, is a little bit different than in Australia, where yeah, again, the focus I think is really more on the therapeutics. Here, there's an equal amount of diagnostics as well as therapeutics. But yeah, so that's been my background. And again, I'm an environmental medicine doctor by training. So after I completed my naturopathic education, I worked with a group called the American Academy of Environmental Medicine. I know there's a sister group in Australia that focuses on environmental medicine. And it's really everything in your environment, from toxins to mold to food and nutrition, that impacts health. And that kind of applies to everything. So I feel like it was a really solid background to work with the patient population I work with today.
And Darren, will you tell us? Because I we were talking about this before I hit record. I know you were specializing in Lyme and mold, and when we did our old interview, we probably had that lens on it. But talking to you now, I'm like, oh wow, you're really working with more children, or maybe you always were, and I just didn't know that part. But what is the population that you're really working with now in your clinic?
Yeah, I mean, I have a pretty eclectic practice. However, most of my patients I see, so I wrote a book on Lyme disease called The Lyme Solution. I had Lyme disease myself back in 2002. So it's kind of my own experience as a Lyme patient and what I found worked really well for myself. So I see a lot of people with Lyme disease and tick-borne illness. And then I also work with a lot of kids with autism, and I've been doing that for over 20 years. And, although it might sound like completely different, unrelated things, again, we find a lot of the foundational issues that people are dealing with any chronic illness are kind of the same. I just got back from a trip in Puerto Vallarta, Mexico, and I was with a friend of mine who focuses on cancer. And we were talking, and of course, a very different world than I work in. But as we're sharing our kind of stories and the way we think about things, it really kind of boils down to, again, these very root cause problems. It's about, gut health. It's about diet. It's a nutrition. It's about, modulating the immune system. So although the disease that presents can look very different, I think, certainly in the naturopathic world or functional medicine world, I think we kind of, hone in on really these core foundational things that get disrupted in the body that lead to whatever the label might be.
Totally agree with you. And I'm really excited that we can talk about children and AMD. But before we get there, when did you bring in, or how did you, with all your experience and knowledge and going to all these conferences and obviously being in environmental medicine for so long, what made you start looking for things like AMD Ion Foot Detox, like their system and their equipment? What made you start researching that? Like, was there a need? Did you come across it at a conference and you were like, this looks amazing, this will help my clients? Was it just that what you were doing in clinic with supplements and diet, you needed more because of the type of patients you were seeing, or what was your journey with finding AMD to begin with, Darren?
So I shared this the last time we spoke many years ago, but I'll share it again because it's kind of a funny story. I used to see AMD at mostly autism conferences. Our friend Glenn Wilhelm, who was their rep there for many, many years, and I was literally the guy that would walk by and I'd see all the people getting their foot baths and the colors turning, different colors, and I would just kind of roll my eyes. I'm like, I can't believe people are buying this. and just very, very skeptical. And again, as an environmental medicine doctor, of course, detoxification is such an important thing we talk about with most of our patients. And there's things like sauna and dry brushing and lymphatic massage. I mean, lots of ways we can help mobilize toxins out of tissue. And although, I saw the little foot bath in the corner, I'm like, it just never really made sense to me. I'm like, how is it, you soak your feet in some water and it just magically gets all these toxins to leave your body? At the time, we were working with a pediatrician named Dr. Jerry Cartznell, who's very well known in the autism world. He actually treated Jenny McCarthy, who's a celebrity, her son, and he was working in our office. And I think AMD approached him because, again, he was also very skeptical and said, "Look, we will sponsor a study. We will give you the machine to use on 10 of your toughest kids, and let's just see what happens." Like, we didn't think there was anything harmful. And he did, and I can't remember exactly how long he did the study for. It was either 1 or 2 months. It wasn't that long. But out of 9 out of his 10 most difficult kids, these are the kids who didn't respond to anything else he was really doing, supplements, medication, 9 out of 10 had a positive response.
Wow.
And I said, okay, here's probably one of the most skeptical people in the world that's now coming back and saying, hey, there's something to this. So we reached out to Glenn and said, okay, hey, oh, actually, I take that back. Glenn reached out to us after he did the little thing with Dr. Cartzel. He approached us and said, hey, kind of the same thing. It's like, would you be willing to try this with a few people and see what happens? And before we even got that far, they actually came to our office and we said, Dr. Jessica Tran, my fiance and business partner, she's very much a researcher scientist. She's like, I really kind of want to know what's in the water because nobody really seems to be able to give us a good idea. They said, well, toxins come out. Great, which ones? Well, it's not practical to test for every toxin under the sun. So we said, let's do this. Let's run a foot bath with no feet, and I'll do one and she'll do one. So we've got one control and then 2 people, and we're going to measure the water for toxic metals, lead, mercury, arsenic, cadmium, and so forth. So we just the regular mode 3 on the solo, and we collected the water in all of our foot baths before, and then all the foot baths afterwards. And to our surprise, in the foot bath that had no feet, there was no difference in the water composition of any toxic metal before and after the 30 minutes were up.
Oh,
In
yeah.
both of our waters, afterwards, doing the 30 minutes, there were significantly higher levels of both lead and mercury in the water.
Wow. I
So
when you
that
share.
was sort of the, donk on the head. I'm like, okay, so what toxins does it pull out? Well, I can't tell you all of the toxins. I can tell you for certainty because we actually measured it that it definitely helps mobilize mercury and lead out of tissue because we were able to measure it in the water.
And
So
Darren, when you talk about measured in the water, are you meaning like you took a test, like a sample of it, and you sent it to the lab and you asked them to measure for the specific, like
yeah,
metal?
so as scientific as we really could be, it was really we took there's a tube, it's about maybe 80 mLs of water that go into the tube, and we literally just dunked it under the water till it filled up and pulled it up. So we kind of stirred up the bath before we collected before and after to try and get fairly equal distribution. And so that was our kind of gauge of, how we collected. So at least the sampling was consistent
Yeah.
between that. But the fact that we saw no change in the foot bath, so it's not like the plate in the water, adding salt, doing all that really accidentally, makes it look like there's something in the water isn't, because again, everything was completely the same in the foot bath that had no feet. But again, the pre and post samples for myself and Dr. Tran were again the levels of lead and mercury very specifically. I'd have to pull the report. I don't recall that arsenic, cadmium, some of these other toxic metals were of any significant, but definitely lead and mercury. And as I recall, I think her levels in the water were higher than mine.
And
So
also, though, Darren, in both for both of you, and you might not know this at the time, were you both more exposed to mercury and lead? Is that why it turned up more in your water? Like if somebody else had heavy metals of arsenic or something else, is that why you?
no, I mean, neither one of us, outside of the occasional fish eating exposure, which wasn't really terribly high. None of us have any other known exposures to lead or mercury. So any of that exposure probably would have come some previous, environmental contaminant at some point. I mean, I live in Southern California where pollution here is pretty bad, so it's probably normal stuff that we just get breathing the air. Could be maybe in our city water, but no specific thing where we would have consider ourselves to be higher risk for having higher levels of lead and mercury. And we do blood tests on ourselves periodically for lead and mercury, and neither one of us has ever had a high blood level, to my recollection.
Darren, that's so even more fascinating because it kind of touches on, when you're looking at root cause health, we see clients and people coming in for foot detoxes with their symptoms in the moment, but often the symptom that they're presenting with, whether it's a rash, whether it's or like whatever it is, you've got to actually peel back the layers and go back to like deep rooted stuff. And so with you, with your experience, if you hadn't been exposed to mercury, in the last year or whatever it was when you did it, like it's like, well, when did that come into your body? Was it in your childhood? Was it in the environment? Was it whatever it was? And how
Yeah.
did that lead to symptoms that you might not even connect to the dots? And it's kind of irrelevant because at least you're getting it out of your body. But it's like, and that's what clients feel like one of their biggest frustrations, with working with clients one-on-one for a decade is, but where did this come from? Why do I have these symptoms? And it's like, well, sometimes it's 30 years ago. And if we haven't given our body a way to detox it out and open up that tissue so it can come out, it just stays in our bodies and we just collect more pollution or more toxins or more environmental things. And then we're just filled up with all of these things, right?
Yeah. Well, I mean, I can look at just my own personal history. I mean, when I was in university, I spent my summers tying up oil tankers coming down from Alaska. My father worked for an oil company and got me a summer gig. So we had a lot of petrochemical exposure, which, a lot of that probably had lead in it. I used to climb into oil tanks to help clean the tank without respirators. And so, I mean, I had a lot of toxic exposure to various things. I used to work in a laboratory, a hospital lab, and I'm sure, had exposure to other chemicals that we weren't aware of. So, no doubt I had plenty of toxic exposure in my younger days. And you're right, when you accumulate a lot of these toxic metals, they can stay in for many, many, many years in various tissues. So, was that something that finally got pulled out? Hard to know, just because lead and mercury in particular are common environmental toxins. Like, again, they get in pollution, they can get in water, they can get in other potential sources. But yeah, we thought that was just kind of interesting. So after we did that little study of an N of 2, and so here we got Dr. Cartznell, who's like, hey, I'm seeing these pretty impressive results in kids with autism. We now have our own little data set saying, okay, we at least know it is pulling out lead and mercury. So we just started trying it. And the one thing I've always appreciated about AMD is the fact that they give people 2 months to try the machine. And if they don't feel like it's really doing anything, they can send it back and get their money back. So there's very few companies I know that sell a product that stand behind it in that way, with that kind of confidence. And I remember talking to Glenn. I think he said their return rate was less than 5%. I mean, very few people felt like it wasn't helping in some way. And now this has been, I can't remember how many years ago that we did that. I think it's probably been 7 or 8. We've now used it with, many of our patients. And again, the overwhelming majority have seen some element of improvement. Now, we still use it a lot with our kids with autism. I've had parents tell they've had better behavior, better language. I could also say I've had some kids that actually get a little bit aggravated and worse when they do it. We found that they can't do the full 30 minutes. I think, one thing you really can't control is the rate of detox. So if it is starting to unload a lot of things quickly, maybe for some very sensitive people, that's not so great. So we have some kids that do 5 minutes, 10 minutes instead of 30 minutes. I've also had parents, get the premiere where they're able to change the different modes so you can alter the polarity. And again, I know for me personally, because I have multiple sclerosis, mode 3 for me, I don't really notice anything. When I switch to mode 5, which just switches the polarity, I feel a difference. So I like for people to be able to, I usually recommend the premiere. So, I mean, I know you can change it with the solo, but you have to, it's a little bit harder where the premiere is just mode 4, 3, 5. You can change it very easily. And I recommend people like try different modes, see if you see a difference in you or your child. Because again, sometimes having all positive or all negative charge, or again, flipping the amount of positive to negative makes a difference in the way you respond. And it makes a lot of sense too, right? Because, different toxins are going to carry different polarities. And if the idea is that you're basically repelling polarities with whatever you're putting in, it may be that one toxin needs this and another toxin needs a different one. So I like the idea that people can kind of play around with it a little bit and see what gives you the best clinical result.
And Darren, when you're talking about polarities, for people that don't know, in AMD context, obviously we know polarity in general life.
Yeah.
What does that mean from an AMD context of the machine?
Well, the best way I kind of equate it is like a magnet. If you've ever played with magnets, if you put magnets on the right end, they stick together. If you flip it over the other one, you can feel it repelling each other. They won't stick together. The idea is the same, is that when you're putting in positively or negative charged ions, if something is of the same kind of polarity, instead of sticking together, it will push it out. So the idea is that we're kind of getting the body to push out the toxins that might be the opposite polarity, or I'm sorry, equal polarity, so that if you're got a positively charged in the water, it's hopefully going to push out some of those positively charged toxins out of the body. So that's kind of the idea behind it. And so as you alternate polarity, at least in theory, you're at some point dressing maybe more positively charged toxins versus more negatively charged toxins. And what about the ones that might be neutral? I'm not sure, but again, I hope someday somebody will actually spend the time and the money to really explore all the stuff that comes out. And there are chemical labs out there that you can measure for pesticides and herbicides and petrochemicals and VOCs. But to date, I don't know that anyone's done that. I know they've done a few small studies with individual practitioners to kind of look more at the clinical aspect of what happens. Do we see any improvement? And of course, as a clinician, that's really what we want to know, is it effective? The deeper scientist wants to know more about what is it that's actually coming out. And yeah, maybe someday that work will be done. But in the meantime, I appreciate that it's safe for people. It's effective for most people. Sticking, your toes in some water for 30 minutes for most people isn't a big deal. And even for kids, again, I work with a lot of kids with autism that often have a hard time sitting still. And it's amazing for the kid who can't sit still, they'll sit still for the 30 minutes water. It's almost
I
like they
do.
intuitively know that there's something healing or happening with that they'll actually do it. So it's actually kind of unusual that I get someone who won't sit still and do it at all.
I agree, Darren. And for anyone that's skeptic and on the fence and is just like, that's just salt and water on your feet, which I was to begin with, which is why I did so much research and like spoke to you and talked about it. Regardless of whether what you've seen in the water, what would be your experience? Like if you've ever had patients that are really skeptical and they don't want to give it a go, from your medical, like from the naturopathic background, what would be your encouragement or why would you encourage them to try it?
I would encourage people to try it because, again, I'm all for anything that's non-invasive, that has the possibility of helping better improve our detox pathways. As humans, we are just bombarded with lots and lots of chemicals and things that aren't well studied, that aren't well researched. I know there was a study that came out many years ago that showed at least the average American's exposed to like 88,000 chemicals a year. Less than 200 have actually been studied for their long-term safety. So we know we're all getting exposed. And as clean as we try to live our lives, I think it's inevitable that, I said, between what's in the air and the water and just out there in the world, you can make your home a safe haven, but you can't control what happens when you walk out the front door. So if we accept the fact that we're all kind of getting overloaded with various toxins, and people say, well, your liver does its job and your kidneys do their job. I'm like, right, but go back in history, go back even 100 years ago. We didn't have the load now that we had then. Our bodies could keep up with it, and now it's just gotten worse and worse. So I think the body's capacity, and certainly depending on your genetic predisposition, that plays a role. Some people are just not great detoxifiers. And I would probably argue anybody with any chronic illness is probably not a great detoxifier. That's part of what leads to chronic illness. The people who are really good detoxifiers probably are less likely to have those kind of chronic health problems. So, if you've got a therapy out there that's safe, seems to be reasonable in its approach. And again, the fact that the company stands behind the product and is letting you basically test drive it for a while before really making that financial commitment, then there's really no harm in giving it a shot. And again, I've even had patients I work with that are skeptical, and I give them the same spiel. I'm like, hey, look, me too, I get it. But here, the company's willing to give it to you for 2 months to try. Try it with your child, try it with you, see if you feel a difference. Because if nothing really changes, and off the top of my head, maybe I've had one or two people who've returned it. Pretty much everyone else has come back and said they noticed there was enough improvement that said it's worth keeping and continuing to use.
And
So,
what sort of improvements do they see, Darren? Like a lot of clients will always describe it to me like that they'll talk about it in terms of feeling lighter. Like they just
yeah.
feel lighter at the end of it, which really in our terms is kind of like that their body's shifted some of the toxins or they've got better mental clarity, like all of those things. But are there some common things that you see with your patient or they tell you report back on again and again?
Well, for my kids with autism, I mean, it's been
Mm.
across the board. I mean, I have some kids that get better language, better understanding, better cognition, better sleep, better behavior, better bowel movements. It's almost like their nervous system in some ways gets a little bit of a reset. I've had
I agree.
adults tell me they feel like they get better sleep, feel less stressed. From my own personal experience, I mean, I noticed the first time I did again mode five, I didn't notice anything really after mode three. Mode five, my gait, my walking was better. So yeah, I mean it really kind of varies from person to person, but um, I think this idea, yeah, of feeling lighter, feeling mentally clear. I think I probably hear about more neurological
Same.
improvement than other physical improvements. I can't say I've heard as much about my gut feels better or my joint pain is less, although I would love to hear that. I seem to hear more about mental clarity, cognition, sleep, mood, those type of things. So,
So like
um,
Darren, those are definitely like and it's like nor are we expecting a miracle fix. It's not like somebody comes in and their rash is gone at the end of 30
yeah,
minutes. But I hear a lot of the same feedback as you over all these years. And I really love this point and I want to touch on it again because you said it and I hear this all the time, especially from other like professionals. And they'll go, but your liver and kidneys are meant to detoxify. And it's
yeah,
like just because we incorporate AMD doesn't mean that me and you and everyone else doesn't believe that our livers and kidneys are meant to detoxify. It's what you've
yeah,
just touched on. The environmental, like, yes, ideally, our liver and kidneys would be doing all of it, and we wouldn't need saunas and we wouldn't need AMD iron foot cleansers and we wouldn't need these supplements and all of these other things. But the environmental toxins and the load for the modern human is beyond anything that we've ever seen from 100 years ago or 200 years ago when we didn't need all these alternative therapies. But for me personally with clients, I'm like, but if you're not doing things, whether it's saunaing or AMD or like those things, you are falling behind with your health because you're keeping these environmental toxins in your body. So you're actually going backwards in today's
yeah.
reality because our kidneys and our livers just can't keep up.
Yeah, well, and then you compound the problem that look how many people out there are on medication, any heart medication, diabetes medication. Well, we know a lot of these medications interfere with liver metabolism. So a lot of the pathways that we would normally get rid of various toxins are now being clogged up because your body's trying to get rid of a drug. So, it's complicated. I think, we don't fully understand the totality of everything we're getting exposed to in our environment. But no doubt that, the culmination of everything we're getting exposed to is definitely impacting our ability to get rid of junk. And yeah, I think anything we can do to help lower our body burden of all these things just makes us healthier.
And also for people that ask, like, how does it work in terms of what you'll probably have a good analogy of this, where it's coming out through our feet? Like people get very confused with that. They're like, but how does it come? Like, and we can talk about the pores opening up and that. But how does it come out through our feet, Darren? How do you explain that?
Well, your skin essentially is a semi-permeable barrier. There's a reason we use medication transdermally. We know that the skin will absorb it and it will go in. Well, what can go in can also go out. So, the idea again of, sort of infusing this influx of positive ions, we're hoping then we're going to create a gradient that will start pushing positive toxins out. So, it's just using that sort of semi-permeable barrier of the skin as a highway to carry things out when we force things in.
And I've got one really good, you might not, this is one question that I'm reading directly. You might not have experienced this. I haven't personally, but have you ever worked with patients that have like, because some of these things AMD tells you to stay away from. So I'm not telling you not to like to give
Yeah.
advice different to that. But have you ever experienced, have you ever used it with clients that have had strokes or heart disease, Parkinson's, Alzheimer's? And have you seen any changes with them?
Uh, Probably not, just because that's not really a big part of
Group.
my patient population. So, would it stop me from using someone with Parkinson's and Alzheimer's? Absolutely not. Especially for someone with a chronic neurological disease. As someone living with a chronic neurological disease, I think anything again you can do to help improve detox pathways would be helpful. I think you always have to be careful a little bit about people who are on various medications. Is it possible in some way it could alter the effect of the medication? Maybe. So I'm always just sort of cautious. I'm like, it doesn't mean you can't do it, but just be very mindful of if there looks like anything's changing in a negative way, do we need to make a change in medication? Now, in a perfect world, I'd love to see people take less medication. If it's
Same.
really doing everything we want, maybe they don't need as much medicine, but it's good to be mindful if you're going to work with that group of people to just be conscientious about making sure that it doesn't interfere with the effect of the medication.
Totally. And we advise, like, before somebody on medication does it, talk to their medical doctor, make sure, because for that very reason, like
Yeah.
I'm hopeful, like you, Darin, and I believe in the big goal of like, well, ideally, if the detox pathways are working properly and AMD, the foot detox helps with all of these things, maybe they need to reduce their medicine, like in an ideal
Right.
world. So we very much, so in a safe way, very much refer back to the doctor to make them aware that they are doing this and the patient, their dosage could change or whatever is happening. So definitely get the sign off from a medical profession because obviously we're not prescribing drugs here. We can't like you
Yeah.
can. And so I definitely agree with that. And Darin, do you have any other final words, wise words of advice for people with doing foot detoxes?
No, I think, give it a try. Again, I appreciate people who are skeptical and don't really feel like it's something that has value, but coming from a space of feeling that way and then kind of having tried it myself, tried it with patients, seeing again that the majority of people have a positive clinical response, give it a shot.
Totally agree with you, Darin. And I was just like you. We were both dubious. That's why we connected over it because we were like, I was just like, "Pfft, whatever." Thank you so much for your time, Darin. I really appreciate your wisdom and your wise words and encouraging people to just give it a go and see what happens. Because, like, is it bad to feel lighter and clearer in your mind from one session and your nervous system feels nice and calm afterwards? Like, I'm all for it. That's what I always say to them. Like, just give it a go.
Great. All right. Thanks, Shelley.
Thank you, Darin. Hang on one second. Why can't I stop the? Oh, yeah, yeah.